Death is something which can happen at any age, at any stage. It's something that all of us in this room and all of us here in wherever you are should think about, because we can suddenly seriously fall ill.
ACP is a legally binding document. That's incorrect. Out of the many documents that we do here in Singapore, it's not legal binding.
It doesn't mean that the ACP has no legal weight. If your preferences are clearly, consistently expressed and consistent over time, it can stand in the court of law, but at the end of the day, it is an aid to the physician to make decisions in the best interest of the patient at that point in time.
ACP cannot be changed once it is documented. That is not true. ACP can be changed and reviewed regularly at any point in time where things in your life change.
It is a process, and we want to really affirm that advanced care planning is a conversation that takes place right from the dinner table to in the community, and then in the clinic, and then in the hospital.
ACP can only be initiated by a professional facilitator. That's not correct. Actually, ACP is a conversation like any other conversations that you have.
You can broach the topic by downloading some of these advanced care planning workbooks from the internet and discussing with your loved one before you then complete the process by undergoing a full process of facilitation with a certified ACP facilitator. So it can be initiated by anybody who is concerned about the patient.
ACP is only necessary for people who are old or ill. Most patients have it done towards the end of life, but actually ACP should be done much earlier, when we are able to carry out the conversation, when our memory is still intact, when we're still able to talk.
In times of crisis, when the patient is not able to speak for themselves, the family will be in a shock, right? Firstly, because it's a crisis and they will be scrambling, trying to find out what they need to do for that person when the medical team asks.
Life is unpredictable, and so it's always good to be prepared. General advanced care planning, it's for patients who are well. They do not have to have an end-stage condition or chronic condition. It is an opportunity to stop and reflect on their life and to share with their healthcare provider what their wishes are.
It may even be about treatment preferences, including related to hospitalization, to radiotherapy, to antibiotics, to place of care. Who will represent them if they become seriously ill?
ACP is expensive. It is a conversation, so the expensive part is really your time, but I think it's a very useful conversation that will be very beneficial.
It is not expensive considering the benefits that you can get from advanced care planning.